Hello, this video is going to be focusing on the bones of the head. So we're going to start by talking about the cranium, move on to then the face, touch on the sutures of the skull, and then finally finish with the clinical relevance. So firstly, the cranium, which is also known as the neurocranium and is essentially the superior part of the skull. So its purpose is to protect the brain, the meninges, and the cerebral vasculature. The cranium can be divided into a roof and a base. So the roof, which is also known as the calvarium, includes the frontal bone, occipital bone, and the two parietal bones, as seen on the diagram. The base includes the frontal bone, sphenoid, ethmoid, occipital, and two parietal and two temporal bones. Because this basically makes the base of the superior aspect of the skull, they articulate with the atlas, which is the first cervical vertebrae, the facial bones, which we will talk about later, and the mandible, which is the jaw. Again, everything annotated on the diagram. Now we'll move on to the face. So the facial bones, or the facial skeleton, which is also known as the viscerocranium, has 14 bones, some of which are paired and some of which are unpaired. And by paired, I mean that there's two of this bone present, and by unpaired, there's just one. So the purpose of the viscerocranium is to support the soft tissues of the face and the muscles, create orbits for the eyes, create the nasal and oral cavities, and the sinuses. Sometimes the frontal bone is also included as part of the facial skeleton. So the bones of the face start with the zygomatic, which is paired. These are the cheekbones of the face. Then we have the lacrimal, which are actually the smallest bones of the face, and they form the medial wall of the orbit. Then we have the nasal bones. These form the bridge of the nose, and they're quite thin. We then have the inferior nasal conchae, also a paired bone, and this is actually present within the nasal cavity. Their purpose is essentially to increase the surface area to then increase the amount of air that can come in contact with the cavity walls. Then have the palatine bones, again paired, which are at the bottom of the oral cavity, and they come to form part of the hard palate. The maxilla, again paired, which comprises part of the upper jaw and again contributes to the hard palate. We then have the vomer, which is an unpaired bone, forms the nasal septum. And finally the mandible, again an unpaired bone, which is basically the jaw. And it, as mentioned earlier, articulates with the base of the cranium, and this articulation takes place at the temporomandibular joint. Now we're going to talk about the sutures. So sutures are essentially a fibrous joint, and you won't really see these in other parts of the body. They're only present in the skull. Form when you're born. They fuse completely by the age of 20. So in neonates, as I mentioned, they're not entirely fused, and there is actually some space that's present between the sutures and the bones, which are called fontanelles. So there's two fontanelles, a frontal and an occipital, and these are quite vulnerable weak points in the skull. So there are three sutures in the skull. The first one is the coronal suture, which is present between the frontal and the two parietal bones. We then have the sagittal suture, which is just present in the middle of the two parietal bones, so separating them from each other. And then we have the lambdoid suture, which is present between the occipital and two parietal bones. Finally, we're going to be talking about the clinical relevance of everything that we've discussed. So beginning with cranial fractures. Fractures to the skull usually occur through trauma or force, and one of the most important clinical areas is the terion, basically the junction between the temporal, parietal, frontal, and sphenoid bone. This is already a weaker point because it's the junction between many of these bones, and right under it lies the middle meningeal artery. So fractures, because this is a weaker part, it's more likely to be injured, and fractures to this area may actually injure the vessel, causing a rupture and then causing a bleed. In terms of facial fractures, with regards to the facial bones, again, fractures result from trauma or force. Some examples of these are road traffic accidents, fights, falling, things like that. So the four most common types of facial fractures are nasal fractures, This is kind of because the nasal bones are very prominent and they're on the bridge of the nose. Capillary fractures, these are usually associated with very intense trauma. Mandibular fractures, usually they occur on the side of the trauma, but then because of the transmitted force due to the mandibular fracture, it can actually affect the teeth and lead to misalignment of them. Zygomatic fractures, or zygomatic arch fractures, and this is usually due to trauma of one side of the face. When it's affected, it can actually damage the infraorbital nerve. So one has to be careful about all of these. And these are my references. Thank you.